What's up guys, Dr. Aaron McElhen here with Revival Performance Physical Therapy, and today I'm going to be showing you guys a great warm-up and mobility exercise for your pecs primarily, but also engages your upper back and your shoulders and really opens up that chest. So if you're like most people nowadays, we work on a computer, we're sitting on our phones, when all day we're working these muscles here in the front, so they're pulling you forward, pulling those shoulders forward, and then if you look at yourself in the mirror from the side, you're probably a little bit more like this, then balanced out in the back versus the front. So that tug of war between these muscles in the front versus the muscles in the back, these guys are winning. So we're gonna give these guys a little bit of a disadvantage, your pecs muscles, and stretch them out and get them some mobility so that when you're strengthening those muscles in the back, it's a little bit easier to pull those shoulder blades back. So when you go in doing overhead exercises, anything like that, it's a little bit easier to do it with proper form where those muscles in the front aren't just pulling you into this position and not letting you do it properly. So simple exercise, all you need is a foam roller, be a super cheap one. You're laying down on it. It's the longer one, the 3-footer. So get your bottom, make sure you're safe as you're getting down. Get your bottom pretty far down, just like the bottom there. And then so your head can still touch, just like this. So you're laying back on it, spread your legs a little bit so that it's a little bit easier to balance. When you've got a real narrow stance in your feet, it's a little bit harder to balance and you kind of try to fall off, so spread it out. And then first thing you want to do is think about that little space right there in your lower back. Engage your core to squish your back flat. So that's going to make sure you don't compensate with your lower back. Most of us, if we have weaker shoulders, we try to arch our lower back too much. So squish your core flat, or put your back flat using your core. And then what you're going to want to do is think about your fingernails, bringing those hands up like you're on a roller coaster and you're raising your arms above your head and keeping that lower back flat, trying to get your fingertips to touch, and then you're just pulling those shoulder blades back. So right here should be stretching, and you're squeezing this thing with your shoulder blades. So in the back of my shoulder blades, in the back there, I'm squeezing the foam roller and I'm trying to get all this to touch. So notice most of us won't be able to get our elbows to touch like this. I've got quite a bit of mobility here, but you'll be able to get your fingernails to touch. So just try to get those fingernails to touch, and then slowly going back and forth, kind of down like this, and then back. So you're engaging those shoulder blades, trying to keep those shoulder blades really close together, as well as keeping the fingernails touching, and you're just slowly going back and forth. So it's like a snow angel. For those of you that have had snow, you lay in the snow and you do this with the snow angel, and it makes a little angel shape in the snow. So just doing that. So keeping that back flat, fingernails touching, and then just slowly going down. You don't have to go all the way down. You can, it's not wrong, but sometimes it allows those shoulders to kind of pop forward. So make sure those shoulder blades stay back. So I usually go just about to the chest level here. So here and then up, going up like this, and then back. So my fingernails are touching the whole time. I'm pulling these back, feeling a lot of pull here. It doesn't feel great, or I don't know, it feels good. It's like a stretch sort of pain though. So that's normal. But if it becomes like a sharp pain, any sharp pains that just don't feel good at all in your shoulder, don't go quite as intense, or just take a break and ask your physical therapist if that's right for you. So do the prescribed amount, have fun.